So hello friends, so today I'm going to make a video on the topic of leukemia. So this is an abnormal condition. Hmm. So first of all that the normal thing that you must know that as you know that so here from the pleury stem cells, basically that this is the pleury stem cells. This is also known as PHSC. So here it divides into myeloblast and lymphoblast, and this myeloblast so here leads to formation of RBC, granulocytes and platelets, and this lymphoblast leads to formation of B lymphocytes and T lymphocytes. And here granulocytes are mainly neutrophils, eosinophils. So these are the granulocytes, and also that is from this myeloblast so here basically monocytes formed. And here, and you should know that the growth of this myeloblast so here basically into RBC, granulocytes and monocytes platelets is controlled by this myelogenous gene, and then so here myelogenous cell. And here similarly that is the growth of this lymphoblast so here into B lymphocytes and T lymphocytes controlled by the so here lymphogenous gene. And here that is as a result that is so here growth of this myeloblast so here basically into these mature cells, and here lymphoblast into these mature cells occurs in a balanced manner. And I now further info now so friends that in the so here in leukocytes also that is formation of so here in the formation of granulocytes and monocytes that I mentioned that from pleury stem cells so here myeloblast form, and this myeloblast differentiates into colony forming unit granulocytes granulocytes and also so here monocytes. And here that's so here it differentiates into promyelocyte so here basically immature so here myelocytes, neutrophil myelocyte, eosinophil and basophil myelocytes. And here that you should mention, as I mentioned, that all these so here immature so here myelocytes they are found in bone marrow only. So here see they are found in bone marrow only, but mature so here that is polymorphonuclear so here neutrophil, and here polymorphonuclear eosinophil and polymorphonuclear basophil, these are found in blood. So therefore that is no so here myelocytes so that is immature myelocytes found in the blood, that in a normal condition. But now I'm going to so here teach you so here basically leukemia. So now I'm going to teach you leukemia. So therefore that is in case of leukemia it is an abnormal condition, so these myelocytes will appear in the blood. And here and through the so here we see examination of peripheral blood smear you will have to show the proof. So now so first of all I'm going to so here give you the definition of so here basically leukemia. So first of all that you have understood that this so here a growth of so here myeloblast and here lymphoblast so here that is in a balanced manner, that is into mature cell occurs due to this gene so here myelogenous gene and here lymphogenous gene. So here if I do a mutation so here if I do a mutation so here in this gene so then this so here a balanced growth of myeloblast and lymphoblast so here into this so here granulocytes, RBCs or into myelocytes, immature myelocytes will not occur in a balanced manner. So therefore that is on the basis of this that I'm going to write a definition also. If you try to write, then you can pause the video and write. So friends, so now I have written a definition of so here leukemia. So here uncontrolled growth of so here myeloblast and lymphoblast. So here myeloblast and lymphoblast due to mutation. So here due to mutation in this. So here due to mutation in this myelogenous and lymphogenous genes. And here and this so here that is causes uncontrolled production of white blood cells, and all this information written in your book guide also I am going to show it. So friends, so this is a definition. So here, uncontrolled production of white blood cells, so here caused by cancerous mutation of a myelogenous and lymphogenous cells, and this process causes leukemia, which is usually characterized by greatly increased number of abnormal white blood cells in the circulating blood. As I saw here mentioned that these myelocytes, so once again I'm going to show this. So now you can see here that this, so here immature myelocytes, so here immature myelocytes, that is they found in bone marrow. This is a normal, but in case of abnormal, so here basically abnormal white blood cells, so here found in the circulating blood. So this is a definition. So now I'm going to show here so the types. So here basically simple. So here, if this leukemia occurs due to uncontrolled production of this, or basically mutation in this myeloblast, so then the myeloid leukemia occurs, or in this lymphoblast, then lymphocytic leukemia occurs. And here, and all these things are mentioned in this part also. So here, from here to this, so here that is all these things are mentioned. But also there is one more important thing that I want to mention is about that is how you get that this especially enlarged. So here we see abnormality in the lymph node, spleen and liver. I'm going to show this now. So friends, so now that is, this is a bone marrow. So here that bone marrow. So here now you can see here that in this bone marrow, so here basically the production of this immature myelocyte, and here basically immature lymphocytes, so here increased, and as a result that this, so here immature myelocyte, so here that is the myelocytes and lymphocytes, now they are going from this bone marrow into the liver, so here spleen, and also in the lymphoid, and also in the blood vessel. And here due to deposition of this immature, so here basically myelocytes in liver, so here that is enlargement of liver, similarly in spleen, so here enlarged spleen, and in case of lymph node, so here enlarged lymph node occurs, and these are mentioned in your book also. And due to deposition of these immature myelocytes in the blood vessel, so here basically, and in the peripheral sphere, you can see here that this, so here immature myelocytes, metamyelocytes appear, as they don't appear in the peripheral blood sphere. So these things mentioned in your book. So now you can see here that is the second type, that is myelogenous leukemia, begins by cancerous production of young myelogenous cells in the bone marrow and then spreads throughout the body, so that white blood cells are produced, especially in the lymph node, spleen and liver, all these things. So here basically that is abnormal, so here basically immature myelocytes occur and are deposited in normal liver, spleen and lymph nodes to cause enlarged liver, enlarged spleen and enlarged lymph node. And the second part, so here you can see here that in the peripheral blood sphere, that this myelocyte and here metamyelocytes, they are not so here similar to each other, they are differentiated, and all these things are mentioned in the book here also. So here they basically more frequently, that is lymphoid cells are undifferentiated, not identical to any of the normal white blood cells. Now I'm going to explain a very important part, effects of leukemia on the body. So friends, so now I'm going to about the effects, but you can see here that in case of normal RBC production, that is WBC platelets, the production of all these cells, so here occurs in a balanced manner. But in case of leukemia, so here the production of the WBC exceeds the production of RBC and platelets. So therefore, so this is not in a balanced manner, this is in an unbalanced manner. So therefore, and all these effects now I'm going to show. So here that is, if the production of RBC reduce, so then anemia will cause, and if the production of platelets reduce, okay, if you don't know, I'm going to explain you about these platelets in the upcoming videos, so please stay tuned for this. Simply that so here thrombocytopenia, so therefore that this deficient leads to anemia, and also that is, but I think that you know about the function of platelets because to do blood clotting, so therefore that is, and this leads to bleeding deficiency. And all these things, man. So friends, so now you can see here, so the common effects of leukemia, you can see here, basically severe anemia and a bleeding tendency caused by thrombocytopenia and lack of platelets. Now, so here, and this is also one of the most important effects. I want to explain this also. So friends, I think that you all know that for growth, that is, a cell requires amino acids, proteins, vitamins, carbohydrates. So here food rich energy and all these things are required. So therefore, and you know that in case of leukemia also, that is abnormal growth of, so here, lymphoids. So here basically abnormal growth of myeloblast and a lymphoblast occurs. So therefore, that is for this abnormal growth of, so here, myeloblast and lymphoblast, so here all the amino acids which are stored in our body, vitamins and food reserves are used. So therefore, that is deficiency of amino acids. So therefore, basically lack of energy, and all these things occur in our body, and all these things mentioned in your book. So friends, you can see here, that is the excessive use of metabolic substrates by the growing cancerous cells. You can see here the leukemic tissues reproduce new cells rapidly that demand based on a body recharge for food such as amino acids and vitamins increases. So therefore, the energy of the patient is greatly depleted, and excessive amino acids by leukemic cells rapid deterioration of normal protein tissues of the body. So this is the cause, and this can lead to death also. So friends, so all these are the effects of leukemia. So anemia due to deficiency of RBC, so bleeding disorder, so due to deficiency of, so here, platelets, so deficiency of proteins and lack of energy. And the fifth one also, so here, weak immunity. Why weak immunity? Because in blood cells, because in blood, so here basically immature, so here in blood, so here you can see here, so here immature WBC, basically myelocytes and metamyelocytes are present. So that's all about the leukemia. So I hope that this video helps you a lot. So please help me by subscribing the channel. So that's all. Thank you.